Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students or nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you are already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. Please make sure to subscribe now. You hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everyone, welcome back nga, and we are back at it again with another fundamentals of nursing test banking. I know that you guys are actually looking forward for this type of videos that I'm uploading, so here it is. And I also know that a lot of you are gonna be in your process of preparing yourself for the upcoming board exam, licensure examination that we have in the Philippines. Let this be your nursing study guide sa pag-aaral mo and in your preparation for the upcoming board exam. Now, if you haven't watched the other nursing test banking videos I created on my channel, I'll be putting the link on the description box. Check the one out. Or whenever the icon button pops out, click the one out because it's all gonna be there for you for free. If I'm not mistaken, I probably created like more than thousands of questions already. So use them, not just for fundamentals of nursing, but for across all concepts in nursing, pharmacology, research, med surge, NCLEX type of questions, maternal, community, all of that good stuff, all for you for free. Use it. And please make sure to give this video a big thumbs up and subscribe to my channel so that you will be the very first one to actually know whenever I am uploading a new video. Now, this is all about your fundamentals of nursing like you see on your screens. And I have the normal test banking that we have the same way it goes. Medyo iniba ko lang yung format ha, para mas matadali ang mga buhay natin. So as you can see, we have here 10 sets of questions that came out from the most recent up until the last board exam that we have. So mind you guys that sa board exam, there are a lot of times that the questions are being recycled. What if lang naman if these questions these questions are going to be included in the upcoming board exam? Oh, the automatic, you have additional 10 points already. Sure ball na yon. And 10 points in the board exam can make or break your score. All right? So, take this one seriously. Same rules applies. 5 seconds. I'm going to give you 5 seconds to answer each questions. And while after the 5 seconds, I'm gonna give you the answer together with the actual rationalization. Is that clear? Now, before anything else, let me just give you, if you haven't already, give you time so you can subscribe to my channel. All right, we are back. So, you guys ready to bring out your pen and paper, and we're gonna answer these following exam questions together. All right, first up, board exam type of question number 1. All right, here we go. In accordance with standard precaution guidelines, when should a nurse wear gloves during nursing intervention? Let me change my pen color here. All right. So here's the scenario. During you're talking about standard precaution. The question is asking you, when should you wear gloves during nursing intervention? When are you going to apply the standard precaution, and when is the time that you're going to apply gloves during a nursing intervention or nursing nursing implementation? All right. Is it A, taking a patient's blood pressure? Is it B, assisting a patient with eating? Is it C, taking care of patient's hair? Or D, performing oral hygiene tasks? Your 5 seconds starts now. Time is up, you guys. What is the answer? The answer to this is letter D. Very good. Letter D nga po ang tamang sagot, performing oral hygiene tasks. Standard precautions are designed to protect healthcare workers and patients from the spread of infection. In accordance with these guidelines, a nurse should wear gloves when performing oral hygiene tasks. This is because oral hygiene tasks may involve contact with the patient's saliva, blood, or mucous membranes, which could potentially transmit pathogens. Now, all right. So you're not going to answer. Letter A is incorrect. Taking patient's blood pressure. Wearing gloves is not typically required when taking a patient's blood pressure, as there is a minimal risk of contact with bodily fluids. Remember, guys, the scenario is being asked, or the scenario that was given is talking about standard precaution. So you will put in your mind, basic hand hygiene. And whenever the patient is on a standard precaution, you have to actually practice hand hygiene. And whenever you are in contact with bodily fluids from your patient, or potential contact to bodily fluids, that's the time that you're gonna wear your gloves. So letter D is the right answer. Nakuha ba yon? Nakuha. Mag-proceed na tayo. Board exam type of question number 2. Let me read to you the question. When a nurse is preparing to measure the temperature of excuse me. When a nurse is preparing to measure the temperature of an alert patient admitted to the hospital due to dehydration caused by vomiting and diarrhea, which method is most appropriate? Now, here's the question. I-dissect natin to. Now, bago natin i-dissect, hindi nyo ba napapansin na during our nursing test banking, I'm not only gonna give you the rationalization, I'm also giving you tips on how to actually attack and approach certain questions. How are you going to do elimination process? How are you going to spot the keywords in order for you to arrive to the right answer? All right? So just be really mindful and be very observant on how I dissect each question for you, because you might want to apply that to your practice, okay? All right. So going back, Going back, so you are preparing to take body temperature. Kukuha ka daw ng body temperature. Ito yung picture, Ayan, So, pero ang scenario mo, ang pasyente mo is admitted due to vomiting and diarrhea. How are you going to get the body temperature of your patient who is experiencing vomiting and diarrhea? That's a chief complaint. Is it A, oral method? Tatadyakan kita. Is it B, axillary method? Is it C, radial method? Or D, rectal method? Your 5 seconds starts now. Time is up, you guys. Very good, very good. Now let's answer this question. The right answer to this question is letter B, axillary method. Let me give you the rationalization. Auxiliary method: when a patient is admitted to the hospital due to dehydration caused by vomiting and diarrhea, the most appropriate method to measure their temperature is the auxiliary method. The auxiliary method is non-invasive and reduces the risk of further discomfort or infection in a patient who is already experiencing gastrointestinal symptoms. Ang pasyente mo active vomiting and diarrhea, tutusukan mo pa yan ng probe sa bunganga. Baka lalong ma-aggravate yung kanyang vomiting, masukahan ka pa, wag syunga. Okay? Hence, the answer is letter B. Nakuha ba yon? Nakuha. Let's proceed. Board exam type of question number 3. A nurse measures a patient's pulse rate and discovers that it is higher than normal. So, the nurse should document this finding as, so ito lang, very simple actually. This is fundamental types of question. I will rate these sets of questions like easy, beginner type of questions. So, I'm really expecting for you guys to get the high score. And in order for me to know that, and in order for me to evaluate your scores, please put your scores on the description box on the comment section below so that I'll be able to know the effectiveness of my teaching. Okay? All right. So here's the scenario. This is very basic. You're getting the pulse of your patient and you discover that it is higher than normal. So pulse, higher. These are the keywords. How were you going to document this finding? Is it A, tachypnea, pulse, tachypnea? B, hypotension. C, arrhythmia. Does the question give you any ECG reading or something? Think about it. Or D, tachycardia. Tachycardia. Your 5 seconds starts now. Time is up, you guys. Very good. What is the answer? Very good naman talaga sa mga brains natin dyan. Gumagana for today's video. Today, you got it right when you answered tachycardia, letter D. Ito, Diyos ko, hindi ko alam kung i-rationalize ko pa to. Tachy means high. Pulse rate, if we're talking about pulse anything that is higher than 60 to 100, that's tachycardic. Anything below 60, your normal value is 60 to 100. Anything above 100, that is already considered tachycardia. Or sa ibang libro, they say 120. But anything, on the other hand, if you're talking about anything, any pulse rate that is below 60, that is considered bradycardia. Hence, the answer is letter D. All right. So when a patient's pulse rate is higher than normal, the nurse should document this finding as tachycardia. Basic. Tachycardia refers to a rapid heartbeat, typically defined as a heart rate greater than 100 beats per minute in adults. Remember, you guys, that we have different normal values when it comes to our patients. It depends on their age bracket. So if you're taking the board exam, NCLEX, or whatever that is, please be mindful of your normal values, and not only when you're taking the board exam, because in real life scenario, when you're already on, pursuing your nursing career, already on the field, your normal values play a crucial part whenever you're trying to come up or intervene to your patient's condition. You know what I mean? All right. So, proceed na tayo. Board exam type of question number 5. Number 4. When a nurse is assisting a patient in getting up from a chair, which of the following actions should be taken to establish, here's the juice of this question, wide base of support. Let me dissect this question for you guys. You're assisting your patient to get up of the chair. The question is asking you, how will you make yourself, how will you have a good foundation in such a way that you will have wide base of support? That's the question. All right. Here are the choices, and let me read them to you. A, bend at the waist position. Bend at the waist. Position arms beneath the patient's arms and lift. B, face the patient. Bend knees. Place hands on patient's forearms and lift. C, position their feet apart to maintain balance. D, maintain firm contact with the patient during the transfer. This question is asking you for proper body mechanics. I want you to really take your time to imagine. If the 5 seconds is too short for you, you might pause it and extend more. I don't mind. But I want you to imagine while you are reading the choices. How does it look like? And how are you picturing having a wide base of support? Your 5 seconds starts now. Time is up, you guys. That's very quick. What is the answer? The answer is letter B. Face the patient, bend knees, place hands on patient's forearms, and lift. When a nurse is assisting a patient in getting up from a chair, the appropriate action to establish a wide base of support and ensure proper body mechanics is to face the patient, bend their knees, place their hands on the patient's forearms and lift. This technique helps maintain stability and balance while preventing injuries to both the patient and the nurse. Hence, the answer is letter B. Are we good? Okay, we're halfway through our examination for today. How's it going? Are you guys following? Very good. All right. So letter number 5. A patient has undergone oral surgery after a motor vehicle accident, RTA. Let's say RTA, road traffic accident. The nurse assessing the patient notices flushed and warm skin. Which of the following methods would the most appropriate to measure the patient's body temperature? Oh, the question is almost the same as number 1, but this is actually asking you for common sense. Your case now is not diarrhea, not vomiting or whatnot, but motor vehicular accident, road traffic accident, and you are being asked to get the body temperature. How are you going to get it? That's the question. Simple, right? But very tricky. So is it A, oral method? Is it B, axillary method? Is it C, arterial line method? Or D, rectal method? Your 5 seconds starts now. Time is up, you guys. Time is up. What is the answer? The answer to this is definitely letter B. Auxiliary na naman. Hindi na talaga tumama yung mga nag-o-oral dyan. Mahilig sa oral. Charing! Alright, here's the rationalization. For a patient who has undergone oral surgery, the most appropriate method to measure body temperature is the axillary method. The axillary method is non-invasive and avoids any potential complications or discomfort related to the patient's oral surgery. Oo nga pala. Ang pasyente mo undergone post-oral surgery after ng RTA niya. So, probably may maxillofacial fracture tayo. So, no, hindi accessible ang mouth. So, automatic, axillary ka. Rectal ka agad, iba naman po pala tayo. Okay. Nakuha ba yon? Nakuha. O, malapit na tayo ha. Last 5 question, make this one count. 5 questions left. Number 6. When providing mouth care for an unconscious patient, the most appropriate position for the patient is sa mga nagtatrabaho sa ICU dyan, you are being asked, unconscious ang pasyente mo, how are you going to provide mouth care? That's the question. Pretty simple. Unconscious patient and you're about to do mouth care. What's the position? Appropriate position. Is it A, Fowler's position? Is it B, side-lying position? Is it C, supine position? Or D, semi-Fowler's position? Your 5 seconds starts now. Time is up, you guys. The answer is letter B, side-lying position. Let me tell you why. When providing mouth care for an unconscious patient, the most appropriate position is the side-lying position. This position allows for better what? Yes, you got it right. Drainage. Very good. Of oral secretions and helps prevent aspiration of fluids into the lungs. Side-lying position po is the right answer, alright? Unless contraindicated. But for this question, since wala namang sinabing other condition ng pasyente mo or clinical presentation, you go with the best option, which is side-lying position. Alright, question number 7. To ensure the safety of a patient who is hospitalized for the first time, which of the following actions should be taken? First time ma-admit ni patient, how will you ensure safety? Ako, this is part of your IPSG ha. Ensuring patient safety from fall. Kung alam niyo yon, yung 7 IPSG. Alright. So, is it A, remove unnecessary furniture to prevent obstacles? Obstacles? Is it B, maintain appropriate lighting at all times? C, keep side rails raised when necessary? Or D, ensure the floor is clean and free of hazard? Your 5 seconds starts now. Time is up, you guys. The answer is letter C. Keep side rails when necessary, or keep side rails up when necessary. To ensure the safety of a patient who is hospitalized for the first time, it is important to keep side rails raised when necessary. This provides additional support, prevents fall, and helps the patient feel more secure in an unfamiliar environment, especially if your patient is taking any type of narcotics or post-op or elderly or ambulatory with assistance, those kind of stuff. Tinatanong ka ng tanong na to. This question is really asking you or gauging your knowledge about fall. Risk for fall. How will you decrease the patient from having or from falling down? If kapag nagtrabaho na kayo sa hospital at nagjo-duty na kayo, you will realize that fall is really, it's like a mortal sin. Hindi ka pwedeng malaglagan ng pasyente dyan for today's video. Okay? Ikaw pwede ka malaglag pero pasyente hindi pwede malaglag. Mga gano'n na eksena. But you will know, you will realize that, or you will come to understand what I'm trying to say once you already passed the board and you started your duty in the hospital. Okay? Now, last 3 questions na nga po tayo, mga kabagang. How are you guys feeling? Let me give you just a quick moment to have grab your coffee. And while I'm doing that, why not subscribe? All right. O, diba? That's so quick. It will not take you time. All right. So, board exam type of question number 8. A walk-in a patient visits the clinic. I'm sorry. Let me read that one more time. A walk-in patient visits the clinic. Complaining of abdominal pain. Eto siya, si Mari mong Zenaida. Charing! Complaining of abdominal pain and diarrhea. This is your chief complaint. Anong chief complaint? Abdominal pain and diarrhea. After taking the patient's vital signs, which phase of nursing process is the nurse implementing? So, niligoy ka ng tanong, pero the question is really asking you nursing process. It is gauging you about your ADPI. Remember your ADPI? Assessment, diagnosis, planning, intervention, evaluation. Okay? Alright. So, alin ka dito? Which phase of nursing process is the nurse implementing? Saan ka daw nag-i-intervene, nag-provide ng nursing action? Igil ako sa'yo. Sko. A, assessment. Is it B, diagnosis? Is it C, planning? Or D, implementation? This is a really tricky question. All right, let's see. Your 5 seconds starts now. Time is up, you guys. What is your answer? The answer is letter A. Wag magre-react. Eto na po. Assessment. When a nurse takes the patient's vital signs, they are implementing the assessment phase of the nursing process. Assessment is the first step and involves collecting data about the patient's health status, including physiological, psychological, and sociocultural factors. Sa sitwasyon na to, you guys, you are taking patient vital signs. Burahin ko nga yung iba dito, parang na... In this scenario, you are taking vital signs after taking the patient's vital signs. Which phase of the nursing process is the nurse implementing? Nasaan ka na daw kapag nagtitake ka or after mo mag-take ng vital signs ng nursing process? Ang sagot, assessment. I'm pretty sure that a lot of you guys probably answered D, but let me tell you why that is not the correct answer. D, implementation. In the implementation phase, the nurse carries out the interventions outlined in the nursing care plan to help the patient achieve their goal and address their healthcare needs. Kumuha ka pa lang naman ng vital signs. Na-achieve mo na agad, na-address mo na agad yung vomiting. Yung abdominal pain and diarrhea. Intervention mo ba yon? Hindi. Right? Collection of data that is, such as taking vital signs, that it's still under your assessment phase. Are we clear? Clear as the sun. Okay, board exam type of question number 9. The following term is best described as a systematic, rational method of planning and providing nursing care for individuals, families, groups, and communities. So, ewan ko, medyo kapatid to ng question number 8. It's definition of terms. These type of questions, you will see this in the board, and these are called definition of terms type of question. So the following term, this is best to describe a systematic, rational method of planning and providing nursing care for individuals, families, groups, and communities. Is it A, assessment? Is it B, nursing process? Is it C, diagnosis? Or is it D or D, evaluation? Your 5 seconds starts now. Time is up, you guys. The answer nga po is nursing process. As you can see, mabilis lang to, elimination process. Assessment, diagnosis, evaluation is under nursing process. This is called umbrella effect. Pag may isang choices na sinasakop niya yung tatlo sa the rest of the options, that's probably the correct answer. Nursing process. Let me tell you, or let me give you the rationalization. The nursing process is best described as a systematic, rational method of planning and providing nursing care for individuals, families, groups, and communities. Diba meron naman din tayong community care plan. Meron tayo nun. It is a framework that guides nursing practice and consists of 5 interrelated steps. We have your ADPI, assessment, diagnosis, planning, implementation, and evaluation. This ADPI. Malinaw tayo dito. Last question, make this one count. In which organ does the exchange of gases primarily occur? Nako guys, pag ito hindi nyo pa nakuha, nanggigigil ako. Saan daw nangyayari yung exchange of gases? Saan daw nangyayari? Alam natin sa alveoli yun. Binigyan na kita ng clue. Saang parte yung alveoli? Is it A, kidneys? Is it B, lungs? Is it C, intestines? Or D, heart? Your 5 seconds starts now. Time is up, you guys. Very good. The answer, tapusin na natin to. Letter B, lungs. Very good. Akalain mo. The exchange of gases primarily occurs in the lungs. This process, known as respiration, involves the inhalation of oxygen, or yung tinatawag nating O2, and the exhalation of carbon dioxide, or CO2. The lungs facilitate this gas exchange between the air and the bloodstream through the respiratory system's complex network of bronchi, bronchioles, and alveoli. Okay? Once again, you guys, these are the 10 questions that I have for you for today. Buburahin ko na ha. Okay. If you want to actually get like a copy of this, I'm very much willing to send it to you. All you gotta do is to subscribe and follow my channel and be part of my Patreon. All right? Because you're gonna have access for this for free, together with the other lectures I have on my channel. Please let me know about your scores down on the comment section below. And once again, I hope you guys enjoyed this one. And I will see you again on my next upload. Tulungan nyo na nga ako, ipamalitan nyo na sa Radyong Sira ang pinakabago, pinaka-fresh at pinakalibreng nursing review center sa balat ng YouTube. And I'll see you again next time. Have a good one.